So there's a saying that nurses eat their young. A lot of older nurses don't want to share their knowledge because they don't want, they feel like they're being replaced by the younger generation. So red flags to look out for when you are becoming a nurse practitioner. So come on in and let's have a chat. Hi, everybody. My name is Anastasia, and welcome back to my channel. If you've been here before, thank you so much for coming back. If you're new, come on in, make yourself at home. Here we talk about everything. So, I did a video a couple weeks ago talking about, things to look out for when deciding to go further your education. For example, if you're an RN and you want to get your master's, if it's even worth furthering your education. So that video got a lot of good positive feedback. But today, I want to branch off a little bit, still talking about nursing, but I want to talk about some red flags or regrets that they have experienced being a nurse practitioner. And I wanted to share it with anybody out there that is thinking about going to school or maybe new in the program. So these are red flags to look out for when you are becoming a nurse practitioner. Number one is the workload. The workload can be underestimated. So, for example, if you're a registered nurse and you're working on a unit, let's say you're working in a med surg unit, you probably see maybe 7, 8 patients a shift, an 8 or 12 hour shift. But when you become the provider, most likely you're responsible for the entire unit. And or if you are in a primary care setting, you're seeing maybe 20, 30, 40 patients a day. So that's a lot, and you can get tired and feel frustrated very easily. And on top of that, seeing patients, you have to deal with reviewing lab work. If you send somebody for a test or x-ray or anything like that, you have to review it, call the patient back, send their referrals out. People send you forms to fill out, calling family members, answering phone. I mean, it's a lot of work to, when you're transitioning from a registered nurse to becoming a provider. So don't take that lightly. It's a very steep curve to navigate. So go in prepared. This is going to be tough, at least for the first year until I get my foot in and understand how things work. Number two is the scope of practice limitation. So a lot of nurse practitioners get very frustrated because you have to have a collaborative physician. A couple of states in the United States now allow nurse practitioners to practice autonomy, but majority of the states you do require a physician collaborator, and that can be frustrating, especially if you don't get a good physician to collaborate with you. So that is something to, a red flag to look for if you are interviewing or applying for a job. Look at the turnover rate. If you're applying for a job and you notice that people keep hiring, they keep hiring because people keep quitting, definitely ask the question, how are the physicians in the practice? Because if your collaborator is not a nice person, it will make your life a living hell. You're going to be miserable. But if you're lucky enough and you get someone that is has a good mentorship ability and teaches you and train you, then that will make a great difference. So three is the pay versus the responsibility. I kind of hinted it earlier. So you might get a raise, obviously going from a registered nurse to a nurse practitioner, but the responsibility that it comes with, you are more liable for a lot of things. If anybody, people are sue happy. If anybody wants to sue you or anything like that, it's coming straight at you because you're the provider. So maybe you might be getting, an increase in pay, but the responsibility and the liability increases as well. And then the next thing is limitation in career flexibility. So a lot of places, if you are the provider, they don't have a lot of positions for managerial positions. So definitely, if you are interested in management versus working clinically, that would be something to look out for. If you're applying to a hospital or to a private practice, ask whether there is a chance for you to grow so you're not always at a bedside. Majority of the big hospitals have, like directorial or managerial positions for providers. But if you're working for like a mom and pop family practice, most likely there won't be a lot of flexibility to move up. You're going to be stuck working bedside and seeing patients. Another thing is also testing and other specialties. So I think primary care, you don't have to have a specialty license. Once you pass your NP board exam, you're good to go, you're good to practice. When I became a wound care specialist, so to become a wound care specialist, I had to take another board exam to become a board certified wound specialist. So after I passed my NP board certification, I think I practiced for a year as a wound care provider. And then I had to take the specialty board exam to become a board certified wound specialist. So some specialties might have additional testing and courses to take in order to be certified. So that's, something to look out for if you want to specialize in anything. I'm not sure if vascular does it. I used to be a vascular provider, but I didn't take any special board exam for that. But wound care, I did. So I had to do that. So definitely that's, a red flag to look out for. And then the last thing is lack of mentorship. So there's a saying that nurses eat their young. A lot of older nurses don't want to share their knowledge because they feel like they're being replaced by the younger generation. So my advice is that just go in, knowing that not everybody is going to be friendly, not everybody is going to be welcoming and willing to share their knowledge with you. And if you go and prepare that way, you're not going to be disappointed. Because if you go in thinking, oh, everybody is nice, everybody's friendly, then you will be disappointed. So, a couple red flags to look out for if you are planning on going back to school to become a nurse practitioner, or if you are in a nurse practitioner program. Just, some things to look out for. Again, there's lack of mentorship, burnout, um, specialty testing and extra courses to take, and more responsibility when you become a provider. So, thank you guys for watching. If you have any questions or comments, any nurse practitioner out there that wants to share any thoughts or any experiences, please put it down in the comments so we can all learn and share. Thank you for watching, and I'll talk to you soon. Bye.